Cardiovascular disease affects people across all corners of the world and is consistently a leading cause of death in many countries. Developing countries struggle even more with additional contributing factors such as diet, exercise, tobacco use, economic constraints, and economic stressors. I would venture to guess that anyone who watches this TED Talk knows someone or has someone in their family that's been affected by cardiovascular disease. Even more alarming is the fact that in comparison to communicable diseases, cardiovascular disease has little priority and is low on the scale of relevance for global health initiatives, despite the fact that it causes more deaths in the world than malaria, HIV/AIDS, and tuberculosis. A new public health initiative for heart disease prevention involves the consumption of fish and fish-derived omega-3 fatty acids to lower the risk of cardiovascular disease and cardiac events. Omega-3 fatty acids are a healthy form of fats that can combat the negative effects of consuming unhealthy fats. Several studies over the past 20 years have tested that omega-3 fatty acids, specifically EPA and DHA, has shown promising results in reducing major coronary artery disease, cardiovascular death, and stroke. EPA and DHA have the ability to lower triglyceride levels, as high triglyceride levels are associated with cardiac episodes. While many studies are supporting fish oil supplementation, many others are warning consumers to do some research and know exactly what you're buying when they go to the pharmacy and pick up a bottle of fish oil supplements. But before we get into that, what exactly happens to the heart to cause the heart to fail during cardiovascular disease? Well, in a normal heart, fatty acids are used for energy so that the heart can pump. However, with heart failure, usually is a result of obesity or diabetes, unhealthy lipids build up to cause cellular toxicity. A series of feedback mechanisms cause a switch away from using fatty acids for energy to using glucose for energy. The switch is often even more dangerous because those with heart disease usually already have an insulin resistance, which impairs their ability to use glucose for metabolism, resulting in further deterioration of the heart muscle and even deeper energy deficiency. Omega-3 fatty acids reduce unhealthy lipid levels in the blood, which can prevent unhealthy fatty acid uptake and prevents the switch from occurring in the first place. EPA and DHA are two specific forms of omega-3 fatty acids and are metabolized for energy and serve as precursors to lipid mediators that control inflammation in diseases such as arteriosclerosis. EPA associates to plaque membranes in blood vessels, which can interfere with pathways linked to inflammation. Less is known about the specific roles of DHA, but it is known that it serves an essential function within the nervous tissue. Omega-3 fatty acids can reduce disease risk through lowering effects of inflammatory markers and platelets. EPA and DHA supplementation can lower blood concentrations of triacylglycerol, which is a marker of cardiovascular disease, and lower the mortality of those who have cardiovascular disease and lower the occurrence of arrhythmias and sudden death. It is well known that very few adults consume the recommended levels of omega-3 fatty acids through the diet, so many medical providers would recommend using a fish oil supplementation to combat a diet that lacks fish. So the patient goes to Walgreens and picks the cheapest bottle that says fish oil on it and walks away and expects to see improvements in their cardiovascular health. So you're thinking, what's wrong with that? Well, not all supplements are manufactured the same way, and some don't even contain EPA or DHA. So one study tested various supplements and advocated that supplements are only beneficial if contents are specified and significant levels of EPA and DHA are present. The supplement that precipitated the greatest increase in whole blood omega-3 fatty acid levels was a concentrated triglyceride fish oil that contained 650 milligrams of EPA and 450 milligrams of DHA. A different group reported that on average, fish oil supplements only contain 180 milligrams of EPA and 120 milligrams of DHA. Ultimately, the study concluded that only a sufficient quantity of EPA and DHA in a supplement will confer the benefits, so consumers need to do research into their supplements if they want to experience a reduction of risk for cardiac disease. Most likely the cheapest option is the one that's the most poorly manufactured and contains no EPA or DHA. So the Department of Health investigated the prevalence of fish oil supplement use and how the supplements are made and manufactured. The report found that fish oil dietary supplements are the most commonly used supplement across adults in the U.S. However, these fish oil supplements are not regulated by the FDA, so their content and chemical integrity are not as rigorously monitored as they are for medications. Additionally, the efficacy and safety of the ingredients are not tested before marketed publicly because the FDA considers the supplement a food product. Evaluating the specific contents of the fish oil supplements revealed that the EPA and DHA quantities were so low that one would need to take 10 capsules a day to reach the therapeutic dose of EPA and DHA present in prescription forms. So, most manufactured supplements are not processed correctly, which contributes to the lack of the beneficial components. Most surprisingly to find out was the fact that fish oil supplement pills are produced as a byproduct from isolating the protein from marine animals that goes into producing animal feed. Furthermore, omega-3 fatty acids are very susceptible to damage from oxygen-free radicals during the extraction process, and as a result, the oils are modified to a point where their clinical benefits are eliminated. So new studies are continuing to research omega-3s, but they keep using different experimental designs that do not use a consistent dose of EPA or DHA. More often than not, the studies don't even use enough to confer the cardioprotective effects they're hoping to see. Additionally, studies are using olive oil as the placebo, which neutralizes the results, as olive oil has its own cardioprotective effects, but is not a fish-derived omega-3 fatty acid. This is why the scientific world is not seeing clear results surrounding the future of omega-3s and cardiovascular disease prevention. In short, cardiovascular disease remains the most common cause of morbidity and mortality throughout the whole world, despite its large volume of recent research on the topic. In the US alone, there are over 900,000 patients who suffer from CVD. While omega-3 fatty acid supplementation appears to be a novel therapeutic approach to lowering one's risk of cardiovascular disease, studies need to standardize the dosage and use properly manufactured supplements, or else concrete results will never be obtained. Which brings up the bigger issue in that manufacturers need to have set standards of EPA and DHA content and need to ensure the extraction process does not damage the oils to a point where their benefits are eliminated. And lastly, it needs to be stressed that supplementation is not a cure to cardiovascular disease, and no therapeutic option will ever surpass the benefits of eating a healthy diet and regularly exercising.